One of the exciting things about these coalitions is that they're bringing different silos together that normally don't speak to each other. I used to practice within a mile of a methadone clinic that I didn't even know was there. And we're seeing counties come together with addiction treatment, with hospitals, with emergency and primary care doctors, with public health, with law enforcement, with school educators, sitting around a table, looking at data, saying where is the problem in our community and what do we need to do together to solve it.
It's been really inspiring to work with the groups who have come together. Everyone from the DEA, for example, the Drug Enforcement Agency, they surprised us by knocking on our door and saying, can we join please? We want to learn, we want to partner. To the medical board, which our California Medical Board came out with one of the first sets of guidelines for clinicians anywhere in the country, followed a couple of years later by the Centers for Disease Control. And so we've been working actively on this issue, first at the government level, because we felt like we had to have our act together before we really put the call out for others to come together.
I got involved in the opioid work after my work with Kaiser Permanente in Southern California. I actually started and helped lead our Safe Opioid Prescribing Initiative, which saw results. So at that point, it was clear to me we were only part of the community, and we needed to reach out to make sure that the rest of the community was part of the solution to this epidemic and not part of the problem.
As I became more and more familiar with what's happening in my own backyard and in my own clinical setting in the emergency department, I became acutely aware of the larger issues in our community. So I chose to take this leadership position as the co-lead in this Orange County Coalition. I've met numerous people, developed some fantastic working relationships. And now there's a larger network of people that I know and who I can trust and gain a lot of information from. Our universe is just our universe, and if we can collaborate, expand, share ideas, I think that makes you much wiser and makes for better informed decisions.
We'd like the faith community to get involved because this goes beyond those who are addicted, those who are homeless, those who are just getting out of prison, those who are suffering from PTSD. These are local members in our local churches who are students, who are seniors, who have just lost a job or suffered an injury. These are pastors, these are deacons, these are executive leaders in our local churches that have been impacted, and the church needs to be informed, aware, and be supportive.
We really, as a coalition, we really hold that space of, we're not just talking about treating, different ways of treating chronic pain. We're talking about different ways of being in our community and getting to the root of the things that are behind this epidemic. And as a coalition, we come from our values. We very early on decided to come from a place of the values of health and safety, compassion, and those are the things that we want for a community. And I watch as we do this work and we come together that those are ignited, those values are ignited in us.